So first we would start with Kuwait. You would check your orders, check your allergies, assemble your equipment, wash your hands, introduce yourself to your patient, identify your patient using your two identifiers, provide for privacy, explain, educate, and evaluate. So today, Mr. Gregory, we're going to provide stoma care. We're going to change out your colostomy bag. All right. So when I've identified the patient using my two identifiers, so once I've done that, and we'll go ahead. All right, so after I wash my hands, I go ahead and put on my gloves. And then go ahead and get my stuff ready. Now, typically you would have a wafer already on there. To remove the wafer, you would go ahead and peel it all towards the center to prevent skin tearing. And then once you've done that, you would want to make sure that you have you can also do adhesive remover as well, which comes in white form. Also, just by itself, it could help as well. Then once you've got the wafer off, you go ahead and perform stoma care, which that's just to help remove the excess that might be around it. Go ahead and clean it real good. When you do that, make sure to use a non-alcoholic based wipe, because if you use the alcoholic based wipe, then you run the risk of actually causing stinging and irritation to the skin. So once you've done that, then you're going to assess the stoma site, and you're going to assess it for the color. You're going to assess it for the shape. Make sure it don't have no discoloration. The shape's good. Make sure that it don't have no signs of infection, swelling, redness around it. Now, and then you also too, once you have a brand new stoma, you're going to want to make sure that the first probably 6 weeks to measure it real good, to make sure that your wafer you're putting on there is actually the right size. Now, when you go to measure it, you want anywhere between an 1/8 to a 1/4 of an inch gap in between there. And the reason being is because you're trying to prevent skin breakdown around the actual site. So once you've performed the stoma care and all of that, then you can go ahead and place your moisture barrier on the actual around the site. And then, actually, we'll go ahead. So then you would perform, so you would place the moisture barrier cream around the site once you've cleaned it. And then measure your actual site. Like I said, make sure to leave your inches that are appropriate to help prevent skin breakdown. We're going to go ahead. I'm going to peel this off. Once you do this, it's really sticky. So make sure you've got it the way you want it before you start to peel it off here. Alright, so we've got our skin barrier cream on there. And once you've done that, give that time to dry and you've cleaned it and everything like that. Alright, so then you just go ahead and place it on there, making sure that it's well and on the site. And then you also too want to make sure you would clamp your bag with a clamp. We don't have any clamps in our kit. And then go ahead, remove your gloves, wash your hands, make sure you have your call light and everything within reach to your patient. Ask them if they need anything. And then after that, you would go and document your actual procedure. And then for this, it also wanted to know what you would do for colostomy irrigation. And for that, that's just training your bowels to help to help so you don't always have to wear a bag. And it also helps prevent constipation, and it helps with any leaking that you might have going on at the time.